Hey guys, Dr. Ray Marque here, your local chiropractic back pain relief center. We're here with lovely Deborah today, and she's got a little bit of neck pain and some low back pain that we're going to take care of. She's a little difficult to adjust, but that just goes that way. Some people are really easy and move easily. She has been a little more of a challenge for us, but we are getting some decompression of these joints. So here we go. First, we're just going to use the instrument. And it just kind of vibrates each one of the joints. Doesn't really cause any pain. Some people actually like it. It's going to break up some scar tissue in there, mobilize the joints a little better. Next is just a massager. You can get one of these like on Amazon. Just loosening the muscles up, bringing some blood flow to the surface, makes the adjustment go easier. Next, we're going to do some muscle work. A lot of people that have neck problems is that this upper trapezius muscle, the lower cervical muscles and things like that get tight and they have spasms. So we're going to do a little trigger point work. I'm going to put some pressure on here. She's going to look this way for me 5 times. 1, 2, 3, 4, 5. And we're going to go to these upper muscles. Go ahead one more time for me. 1, 2, 3, 4, 5. And this is kind of an area that a lot of people get tension. Some people come in with no pain right here, but it kind of hurts them right here, right around that shoulder blade area. Very, very common symptom, and it's almost always because we have some trigger points in these upper back muscles that can cause quite a bit of pain. Okay, look this way for me. 1, 2, 3, 4, 5. One more time. 1, 2, 3, 4, 5. Okay, it's gonna stretch you a little bit. A deep breath for me. Let it all out, and we're gonna drop your hands to the floor. Good. That's probably one of the better ones, huh?
Yeah.
Let's go on your back for me, face up. Now we're gonna do a cervical adjustment. Like I always say, half my patients love it, half hate it. If getting your neck cracked is stopping you from coming to see me, don't let it come in and see me. We can do other things to you. But Deborah responds pretty well to this. Good. Good. Moving well today, Deborah. Come on up. We're going to sit on the edge and face that way. Now we're going to do a mid-thoracic upper lumbar adjustment. Okay, real tight for me. I'm going to squeeze pretty good. There we go, a little bit. Good. 2 of them.
That was awesome.
All right, good adjustment. Thanks for watching. We'll try to get a couple more this afternoon. Everyone have a great afternoon. Bye-bye.